Around the world, there are places where people live longer, healthier lives. They're called blue zones. From Okinawa, Japan to Loma Linda, California, these communities share habits that promote vitality and longevity. But what if one of those places was right here in Florida? Welcome to Leesburg, a town with a rich history and a question worth exploring. Was Leesburg once a blue zone? And can it be one again? Join us as we uncover the past, examine the present, and imagine a future where we all live better and longer.
So this is our weekly meeting of our Rotary Club. We've been meeting here for almost 99 years in Leesburg. So next year we'll be 100 years old. So this club has a lot of history going back to 1926, of which we're going to be talking about the history of Leesburg when it was kind of almost a little bit of like a Shangri-La where people lived long lives. And how do we bring back that strong town, that strong small town spirit today? Well, there's a subject called blue zones, which many other communities are using to figure out how to bring back community again and make Leesburg a strong town. Keep eating, everyone, including Dr. Weiss. I'm going to give you a few highlights from Dr. Weiss's bio. It's a long bio. I published it for those of you who have gotten the invitation to this, but I'll give you some highlights, especially for those who may be watching this on Lake TV. Dr. Alan Weiss is the Chief Medical Officer for the National Blue Zones Project. Having practiced dermatology, did I say that right? Rheumatology, gee. See, I'm not a professional doctor, but internal medicine as well as geriatrics for 23 years. He was also, most importantly, president and CEO for 18 years of the 716-bed two-hospital system in Naples. Dr. Weiss now has a national scope focused on prevention, which is what he's going to talk to us about today. Looking through just some of his other outstanding achievements, he's been honored as one of the top 100 outstanding physician leaders of healthcare by the Becker's Hospital Review System. He's been on review boards and hospital boards for our entire state of Florida. For a while, I remember reading you were on the American Hospital Association board in Chicago from up in my homeland, as well as quality committees for a Healthy Florida, the Florida Hospital Association, and many other past achievements, as well as specifically as he transformed Naples into one of the healthiest cities in America. The city leaders there gave him the keys to the city of Naples for his steadfast commitment to enriching the lives of the general public, which, as we know in this day and age, with our fast-paced cities and our faster-paced lifestyles, is a huge challenge. But Dr. Weiss is here to talk to us about how, despite the Herculean task that we all think in making healthier cities, healthier communities, and living longer lives, there is some real simple methodologies that we can all take to practice in our personal lives, and more importantly, in building community again, in building kind of strong town communities that our Lake 100 leaders and others have. So with that, Dr. Weiss, come up and tell us a little bit about how we do it.
Thank you, John. And thank you all for being here today and your interest in being so warm and welcoming. And as we all gathered before this more formal part. So I'm going to sort of see the question in the beginning. It's not to be answered right away, but what do you think Lake County should look like 5 years from now? You already have an excellent program going on right now for the past couple of years about development and changes and where to go. But just think about that also. And that when we have a discussion time, after I go through it, just a short presentation. You've already gotten Blue Zones 101 2 weeks ago. I've got one or two slides just to get everybody up to speed. But really, what do you want to look like 5 years from now in terms of health, well-being, life expectancy, commerce, growth, attractiveness for folks who are already living here, folks who want to come down and live here, how best to continue to thrive the way you have in the past. I got here a little early this morning because I didn't want to be late, and I had the chance to walk around the lakes here, and it was just magical, literally magical, about what a nice environment you have. So the other question I'm going to ask, and just a facetious one, you don't need to answer this one, but who wants to spend a night in the hospital? You got some good hospitals nearby. I mean, anybody here want to spend the night in the hospital? I didn't think so. So if this same slide comes up at the end, and if you want a copy of the presentation, just either email me or text me on that phone number, and I'll be real responsive. Or if you have other questions or want some general information, just take a snapshot of it. And I didn't put a QR code up there, just make it simple for all of us. Just one quick slide on where we were today as a country. And it's a little painful to start with this. We're going to end up on the high note, but this is just a little bit painful. We spend more money than any other country per person on healthcare, and we get the worst results of any of the developed nations. So that is a formula for failure. That doesn't need to be that way. We don't need to have that. Real numbers, France spends less money on healthcare than we do as a percentage of gross domestic product, and they get to spend more money on education and infrastructure. Wouldn't you rather educate people rather than take care of sickness when they get sick at the end? We're overweight. We have diabetes. We've had two presidents who have had wars on cancer, and I couldn't agree more. But I alone could cure. I could win the war on cancer. So you say, well, this guy's up here for 3 minutes, and he's already saying he can do these things that are impossible. And it's real simple. Stop the sale of tobacco. Stop smoking. That's the number one cause of death in the country right now is cancer, and it's related to tobacco. About 90% of the people who have lung cancer have had tobacco exposure. 10% is just bad luck, bad genes. You can't really do much about that. But if you did that, you change the whole course of things and free up a lot of, first of all, you'd avoid misery and you free up a lot of resources. The other thing is, the rate we're going right now, our kids are going to predecease us. It's a horrible thought. Each generation wanted the next generation to do better and live longer, live better, and so on. That's it. So Blue Zones 101, 102, you heard all this a couple of weeks ago. Moving naturally. The pathways that you have here around the lakes, magnificent. The monuments with the wonderful quotes are inspirational. You get both at the same time. This is the second one is downshifting. I've had trouble with this all my career, and people here who've had long careers as judges and in school board and so on, I suspect they've had trouble with work-life balance, and they're sort of workaholics, like to be busy and engaged. So that's another one, work-life balance. But having purpose in your life. A lot of us are at the retiree age, but having something to help someone to keep engaged, to be involved, that's very important. People who believe they can live to be 90 have about a 20% chance better of becoming 90. They get from 90 to 100, you need to have good genes. Right now, it's too late to change your parents, and you can't change your genes yet. But see what happens with modern medical science. Eating wisely, eat till you're 80% full. Don't overeat. Have a plant slant diet. We've got folks in the audience who are vegans and I suspect some vegetarians, and it's just remarkable how much better those folks do. But the general public, myself included, if you just go to plant slant, having a portion of meat the size of the palm of your hand a couple times a week and no more, you'll do much better off. And the other thing with food, and we had a vodka and gin discussion, very interesting during the warm-up time just now. There's a New England Journal of Medical article came out 2 weeks ago, and alcohol in any form is really not good for you. Now, I tell people I never really drank till I was a hospital CEO, and that's actually the truth. I was out with donors almost every night, and they drank, I drank, but now I'm down to just, you know, for celebratory occasions. But alcohol in any form is probably not good for you. Original Blue Zones, they had folks were having about a glass of wine at 5 o'clock with socialization. So the socialization probably had a big effect. But nonetheless, if you don't drink, don't start. And certainly, there's a whole bunch of guidelines for men and women vary slightly just due to body size and metabolism. The other most important things I think, and most people think, is having friends. COVID was bad. I can't say anything good about COVID, but one of the worst unrecognized things of COVID was the loneliness. It separated us. And the face-to-face communication, just a hug. I got one hug from, and I really didn't know anybody here today, but that human touch is just so important. It makes such an important difference for everyone. Belonging to a organization, a faith-based community, and it is regardless of the faith, belonging and going a few times a month and participating, those folks live 4 to 14 years longer than folks who don't go to a faith-based organization. And then the basic is having families, multi-generational families, staying in touch with your kids. It makes a big deal of difference. Last night, I'm from Naples and drove up to Tampa where we have our daughter, son-in-law, and an 11 and 13-year-old. The 13-year-old keeps comparing his height to me. He's going to make it. I'm getting shorter, but he's really accelerating. But just having that multi-generational family and seeing the hugs and the being interactive is very important for everybody. So if you have the opportunity, certainly take advantage of that. So that's Blue Zones in the past. These are results. So Robert Wood Johnson, and you can get the slides. They each year they do a full evaluation of counties. So these are your results from 2020. Lake County is pretty good. So even though, and I've got some background, that every county, there's 67 counties in Florida, and most every county has areas that have been resource challenged and other areas that have been resource rich. And there's a lot of demographics that I'm not going to go into why that happened. But when you look at the health outcomes, and I'm going to show a picture of that, and you're in the second quartile. And then for health factors, same second quartile. But Robert Wood Johnson does everything from number of pediatricians per 100,000 people to premature death to drug and alcohol use to homicides across the board, literally hundreds of different statistics. And from 2020 to now, last year, 225, basically hasn't changed. So that question I asked in the beginning, what do you want to be when you grow up? What do you want Lake County to look like and be noted for 5 years from now? The healthiest in the state, longest life expectancy. Those are some of the things that were aspirational when we started with Naples. And the rest of this time, I'm going to really just show some examples of some communities that I'm involved in right now. And the one that I grew up in, as was mentioned, I was a hospital CEO, and my neighbor at the table was asking, how did you get into this? Well, about 2013, I've been the president in the hospital there for 13 years. And prior to that, in private practice, and we get people healthy, they get sick again. We get them healthy, they get sick again. A couple of times that, and then sometimes the luck would run out, and not so good. So I said, this is crazy. There's got to be a better way of doing this. I also, at that time, thought that the way we paid for healthcare was going to change. We pay for fee for service. So I sent both of our daughters to medical school on rheumatoid arthritis. I love chronic illnesses. I'm kidding. But it's like an annuity. So people with rheumatoid arthritis or diabetes or hypertension, I'm kidding. So don't, this is on the record here. So I want to make sure that's the parent and don't get quoted out of context. But you think about it, we're the healthcare profession, noble profession, I'm very proud of it. Healthcare systems, hospitals, proud of them also. You've got big pharma, the drug companies. You've got the device manufacturers, the people who do the pacemakers and the hip replacements. And you've got the insurance industry. So what happens when people stay well to those 5 entities? What happened to the Maytag repairman when Maytag used to make a washing machine that would work forever and didn't need repairs? It, they go out of business. Yeah, it's counterproductive to get into prevention. So I thought back then that the healthcare reimbursement was going to change, and that was going to be paying for people to stay healthy. So we would get a cohort of people, 400,000 people, I'll use round numbers in Southwest Florida, and we would get paid to keep them healthy. We'd get a certain amount of money per year per person. Right now, Medicare spends about $15,000. I don't know the number for this county, but about $15,000 per person per year. But if they say Medicare, we're going to give you that money, but if you keep people healthy, keep them from having heart attacks or strokes or anything else, you get to keep the money. If they're real sick, they're going to exceed that, and you're not going to get you're going to go into the red basically. So I thought that was going to happen. So I said we ought to do this prevention thing. Number one, is the right thing to do, and number two, it's going to be financially the right thing to do. Shopped all over the place. Went up to Iowa, was out in the beach cities in California, and I got one slide in here on that. And then ran into this Blue Zones. Read the National Geographic article, second most read article ever by National Geographic, and took a big chance. They had only been doing this for about 8 or 10 years and didn't have a long life experience. 2015, I go to the hospital board that I'm with. We were on a roll where our numbers were good in terms of quality. And you can look at your local hospitals, go to the Centers for Medicare and Medicaid Services, CMS, and they have a 5-star system, 1 through 5-star, and you can see what your hospitals are here locally. You want to go to a 4 or 5-star hospital. Don't. You spend more time shopping for a car or trying to figure out a washing machine than you do for healthcare. Go to CMS or there's the one other one is Leapfrog. They go A through F in rating your hospitals and do that. So we got going. Board took a couple convincings to get done. We started. In 1 year, we had modest success, which I'll show. But in 2 years, we had to audit the results because I didn't believe them. They were so good. This is what happens with health. We can work on the environment. We can help work on healthy behaviors. So the environment takes your area, and this county is already onto it. They're looking at the roads and walkways and pathways and bike lanes, and Florida's got a corridor going up and down the center of the state. That's good for recreation. It's also good for migrating animals and so on. But the other thing is healthy behaviors. Getting kids off the right start, eating well, keeping from. So one of the communities I'll show, the little jewels, the smokeless. They got into the middle schools and the high schools, a huge problem for everybody. So this is what happens. Genetics you can't change yet. Access to care, we're not bad with access to care. There are a whole trend of folks who are against us. So I mentioned that the healthcare systems and those they like the system the way it is right now, promoting sickness. But you've got the food giants. Bet you can't eat one, that refers to Pringles potato chip. The things we like to do. And now for the next couple minutes, I'm going to take you through a couple of Blue Zones areas. And I asked our board at the time we did this, the same second question I asked you all. Who wants to spend the night in the hospital? So it was a group that looked just like this, a board a little smaller, it was about 15 folks. And I said, our quality is pretty good. We were a 5-star at that time with CMS, and we did great with heart attacks and strokes and so on. But don't you want to spend on it? And I said, well, how about your neighbors? Let your neighbors spend the night in the hospital, or do you want to keep people well? So they said, no, let's try keeping people well. And it was a career limiting step for me because it was not inexpensive. If it didn't work, I'd be looking, I would have been doing something else since then, but it worked. So we started looking at our own employees. You got to eat your own cooking, okay? So we had 6,000 folks we insured. We started with them. And we got the regular pushback. You're not going to tell me what, I'd walk into a room and say, look. So I'd go up to somebody who looked like they were old enough to have a child who was going to get married soon, and you're a volunteer. And I say, do you want to be at that wedding? Because if you stop smoking, because these were the smokers, because we said we weren't going to hire new smokers. We're going to help you stop smoking. If you couldn't stop, we weren't going to fire you, but we'd really like you to stop. So everybody had the choice. But my line, and it worked very well, was I'd say, you want to go to your grandchild's wedding and, be able to complain about how much money they spent on the wedding and the other side's marrying down, the regular comments, or, or not, because everyone wants to walk down the aisle. But, it got their attention. But so we had these things, and we did the U.S. Prevention Task Force. So age 50, we gave you a birthday present, colonoscopy. And if you forgot about it, that's assuming you had no risk factors. I started PSAs on men at appropriate ages and followed along. Mammography at 45, that was controversial at the time. It was 50, then we went down to 45. Everything's better. If you're going to get bad news, you want to get it right away. You don't want to wait on it. But nothing crazy. And the data was all segregated. Nobody knew anybody else's data. It was a third-party thing. It worked. So we lowered body mass index, that's height and weight, a tremendous waist circumference, fats. We found a lot of occult cancer, more than we thought we were going to find. A lot of colon cancer, and that surprised us. So we have nurses, and one of the nurses, a thought leader, nice lady. I didn't know her real well. We had about 1,200 nurses. But she said, I'm not going to have a colonoscopy because, you lose your privacy and so on. I said, look, I'm getting a colonoscopy. It's not that interesting, okay? And then it turns out that she had an early lesion in her colon, which was taken care of. And she came back and was a major advocate for us. And it was really heartwarming. So we got a 98% overall satisfaction. I never got a 98% on anything in my entire life, any tests or anything else, but people liked it. And we did it for spouses. We did it for kids age under 26. But the most amazing thing, which I didn't believe, is we lowered our healthcare costs 54%. So this is just a trend line. So when you get healthier people, you pick up stuff early. It makes sense. I had the numbers audited because you never know, but they're real numbers. So then the rest of Southwest Florida said, look, we want to be like the hospital, the county employees, the city employees, the sheriff's department, school system, big employers. And we got into the same thing. So we got tremendous notoriety on national news. The Today Show had us on. We increased productivity. It was easier to hire and retain folks. Satisfaction and engagement improved. People were happier. People were friendlier. Is it subtle? Yes, but you see these groups out walking, and typically, and even some, an executive suite, and I don't have the picture in this slide deck because I won't go fast, but the folks I work with as the executive assistants, they would switch out of their heels, out of their high heels, into sneaks and socks and take a walk at lunchtime. They'd come back. They were happier. We were happier. Everybody was happier. And became the new norm. And then they'd have potluck lunches where they bring in healthy stuff. I'd crash the lunches. I never brought in anything, but whatever. It wasn't fair, but we had a good time with it. We had 225,000 of the 400,000 folks engaged. That's pretty good. What happens with blue zones, 20% of the people are already what I call tree huggers. They're already into this. We have some of them in the audience who are unbelievable stars. Then you get to 60% will convert over. 20% Darwin will take care of. And Darwin never sleeps. But don't spend a lot of time and energy on those folks because you won't be able to get that 60%. So you get 80%. Don't let perfect get in the way of good. So that's really what you have to be looking at. So here's just some raw numbers. The public school system embraced it. We had 54 schools. The schools numbers in Florida, somebody correct me if I'm wrong, but I'm fourth grade, eighth grade, they have standardized test scores across. And then in high school, they got a different set of metrics. But the scores went up. And what happened, which was completely unexpected, was that the absentee rate among the students went down as the schools converted to blue zones. So the most unexpected thing was the teachers' absentee rate went down also. Now, we don't know if it's because the kids weren't bringing in flu and germs or people were just more engaged. But it happened at school after school after school. There were one or two special schools they couldn't do with, one with the disciplinary students or whatever. It didn't fit with that, but most of the schools it fit in very well. Grocery stores embraced it. Faith-based organizations loved it. It brings in people. It's very congruent with all the major faiths. Again, with everybody. Look at the rightmost column. The ones with asterisks are statistically significant, and basically well-being goes up. Uh, all the ones went up in general, statistically positive. It's not perfect, but it is pretty good. So these are the regions in Southwest Florida. So downtown Naples is affluent and so on. But you go to East Naples, which is a little challenged, uh, and the ones that have the most to improve the most. So you can try and go. It's like getting an A student to an A plus. You can do it, and it's nice. But you get a C minus student into the Bs. That's got to make you feel good. This is a different. So that's Naples, Florida, Southwest Florida, all the way out to Immokalee, which is really resource challenged. It's migrant farmer workers. It's a tough. But they're good there. This is Fort Worth, Texas. This is the and look at the some of these pictures. That the bottom left is Ramey. He's got Ramey's Market, a bodega, and it's in a food desert, and it's also a very high crime area. And the crime statistics are very accurate there. The place and the time. They're good numbers. So we helped Blue Zones helped him get a refrigerator case in, and he started carrying fruits and vegetables fresh. You go to a Dollar General and Joe buy a bunch getting here. They never have fruits and vegetables. But you go to his place now, and people started walking in the neighborhood, and the neighborhood started getting safer. So you see the 4 policemen. They used to patrol the area as 2 pairs walking in a pair. So you had 4 policemen at a time. That's how bad a neighborhood it was, which is saying something. But then when people got out, the crime rate went down. People started to walk. The kids, and you look at the picture on the middle top, the local high school art students painted over the graffiti, and parents were happy with it, kids are happy with it. It makes a big difference. Community pride comes along in a big way. Here's the market being transformed. These folks were ranked in Fort Worth 185 out of 190 metropolitan statistical areas. They dropped down, they came down to like 53rd. 53rd came down. Dramatic improvement, big community, close to 1 million folks in Fort Worth. This is the change, and this east southeast, that was the most resource challenged area. The rest of the country's well-being is going down during this time. Theirs went up. They started in 2015 also. So Blue Zones folks, when I was still a hospital administrator, I wasn't on this speaking tour for them, which is really what I'm doing right now. Is just public relations, and I drove up here on my own, and I'm having a great time, literally just seeing what's going on and meeting with everyone. So they improved. Improvement in well-being score went up 3.6%, 8% increase in residents reported that their city or area where they live is perfect for them. People become much more philanthropic. 23% of the folks decreased smoking. People started walking, exercising. It's a big deal. Different community entirely. Corey, Pennsylvania, Northwest Pennsylvania, old railroad town where they used to have the manufacturing for railroad locomotives. They don't do that anymore. The town was falling on bad times, brought in Blue Zones, and the numbers are, again, it's the same numbers everybody sees after 2 years. It takes about 6 months to get the team in place. Always get local folks who grew up, went to high school, have friends and family, know the local restaurants and where we go for church, or after church for food or whatever, know the area, trust is already there, and then fill out a team, and they get involved, and then the magic happens. So you get some results in 1 year, but in 2 years, dramatic. Same basic results we showed 2019 to 2021. All these parameters changed for the better. This is what's possible. So big community, small community, another Florida community. This is their improvement. This is their risk prevalence went down. We have so many metrics you can't keep. We have 600 metrics. So, you need really a statistician to do that. And I've seen that program. It will put us all to sleep right now. But so I'm just took the highlights. This is their return on investment cumulatively, which is overall. This is the state of Hawaii. The entire state went Blue Zones, and they're now ranked 1, 2, or 3 overall for wellness. and well-being. And it's a very diverse state. If you've ever been to Hawaii, a lot of ethnic groups, multicultural, and geographically challenged. It's a bunch of 8 big islands and a bunch of little islands. So getting around it, it's not like Florida where you got everybody can basically drive from you can, one end of the state now, from Key West to Pensacola, it's a hike, but you can do it. But in the bulk of the state, you can drive around here easily. This is Brevard up in North Carolina. I did the talk there for them at their 2-year anniversary. They had the fortune of starting this just as COVID started. Wow, what timing. They got started a month before COVID. And look what happened with them as they got through COVID. You can see the masks in place, but exercise, blood pressures, lip, flat fats, obesity, tobacco, they had dramatic results in the face of COVID. Thriving, learning, money, it's the same monotonous story in 75 communities. It happens. Now, the typical thing when I go into a community, later this afternoon, I'm talking with folks over in Palm Beach, obviously not in person, but they say, well, we can do it ourselves. We have a lot of resources. We can do it ourselves. And I said, yeah, look back 5 years, see where you are and see where you are now. So if you could do it yourselves, how come you didn't do it? Help me out with that. So this is the same set of metrics, same asterisks for statistically significant. This is the 2 years going into COVID. Another couple of years will probably all become statistically. So we do a lot of numbers. If you can't measure it, you can't change it. This is a more detailed one, purpose, well-being. You can see the same numbers in the right-hand column as to what happens and what goes on. This is well-being. The obesity rate went down, people exercising, walking, blood pressures get better, felt productive and active. It changes the spirits. You see somebody in the supermarket and they start talking to you in a nice way. It changes the whole culture of friendliness. It's a very interesting phenomenon. Tobacco use, this is very interesting. So you see the 18 to 29-year-olds, what happened? Vaping got into the high schools and middle schools. Vaping is a big problem. And the vaping comes in flavors that are really cherished by that age group, banana and chocolate or whatever. I'm just making it up. I don't know the flavors, but the tobacco industry is very clever, just like the food industry in terms of habituating us. So that went down, but everything else got better. So they'll work on that. These are the beach cities. These cities measured their school scores and they went up in all the schools. This is like a 5-year results rather than the early results. Same thing, obesity goes down. So what's the secret? You got to persevere. You got to take the chance in the beginning as a community. You got to hang in and make it happen. This is what happened. So COVID comes along. Everybody's isolated, myself included. I got all this data. I'm sitting at home with my wife. And I said, well, let's do a COVID paper. And what happened is that the Blue Zones communities during COVID did much better in terms of mortality and morbidity. Those numbers were available also. So we just matched them up. And why did that happen? Because the Blue Zones communities initially have lower blood pressures. Those folks take fewer medicines. And they're more socially interactive, so they stay distant physically from each other, but they still interacted some other way, either by distance or one other. So they did well, and they were less likely to worry or panic, and they had less stress going into it. So if you're healthier going into a challenge, you're obviously better off. So this is a fun picture. This is the typical, cutting the ribbon at a school that just turned Blue Zones. The elementary school kids are infatuated with that scissors. That's the only thing they remember about the whole day. They just love that scissors. But it's fun, interesting, and then what happens, and I'll give you one example, they'll take the kindergarten through second grade, sometimes third grade kids, and have them run around the playground or before school starts for 10, 15 minutes with supervision, and so they don't run away or anything like that. Then the teachers who know those kids say they come in and they're settled and they're ready to learn. The boys don't fidget as much, and they pick up a lot of time and just generally do better. This is the same slide we started with. Again, if you're interested in more information, I'll send you some easy stuff. I'm not going to spam you, but we'll send you some things. So, first question. So questions, answers, discussion, everything's on the table. What do you think we're capable of here locally? What do we want to be when we grow up? We don't want another study. We don't want to, you got plenty of good studies going on already. So what do you want?
Where do you start?
Right here. Right. So where to start? And I'm going to give you an answer, and it's not facetious, with a group just like yourselves. So when I was invited up here, Jim couldn't have been more gracious in giving me information about the county and so on. And I said to you, Jim, I think yesterday we were on the call. I said, I view this as a first, and no one to get offensive at this, as a first date. Okay. We got a friend who's fixed us up. And I don't, from both sides of the first date, just want to see if, we're not getting ready for the senior prom or anything more serious. This is just the first date, but we start here with an educational program. And, this is the way it started. If we can get and this audience is great, and you're thought leaders and leaders. But if we can get a group like it's meeting evidently right now also, overall what can happen in this county, get in front of them with the longer version of a program like this, which is educational, not salesy, just education, of showing where Lake County was 5 years ago, where you are right now, and say, well, what do you want to do? Okay, you have the studies, you spent a fair amount of money already. And then once you get the groups coalesced, once you can form folks who want to do something differently rather than just seeing the same old, and want to make a change. Then go to the folks, and I guarantee you have folks here who are capable of supporting an initial assessment. You are doing wonderful things here already. This park's a perfect example. You are other wonderful things that are here. So we find out what's wonderful and what's going on. We find out people who already have the trust of the community, and they become the executive directors or directresses of the program. And then we get going. After the assessment, we get a baseline, hire in folks who are involved in restaurants. The person we had in Southwest Florida who did schools was a recently retired school superintendent from up north, so he could connect easily with all the schools and knew how to talk to the teachers. He's the one that got those elementary school kids so wild. I didn't do that. I just stuck up there for the picture, but he was the one that did that.
So how big is the toolbox that that team would, use? And you gave a couple examples, like in schools getting children out for recess more. What are some of the
We have 250 to 300 best practices. So each week or every other week, the people who are the executive directors, the people who are the restaurant and commercial folks on the teams from around the country, they get together virtually and they share stories organized of what's working in their community, what problems they have. They'll start with the problems because people just could say turn over and say I'm selling a lot. So you go to a grocery store. I'm not a grocery guy, but I said I've got all this soda and stuff up front and it's selling pretty well. And somebody else will say, look, I got them that fit in healthy. Pepsi and Coke have a set of healthy products. They put them up front, and I had grab and go healthy, and the stuff flew off the shelves. So they'll share best practices. Please.
A lot of the examples you used the 5 year timeline to be where do you want to be in 5 years, where were we 5 years ago? And then a lot of the questions that came up before, what are the practical actions? And in your discussion, you mentioned how you talked to the board first, or the leaders or the ones that were raised here, and then they established a thing which you just called 200 practices that have been tested in the community. Does the fact that you're just educating those leaders in the community that have influence or affluence to say, hey, this is a possibility, we can live longer, your children can be healthier, is that enough to kickstart it? And then why the 5 year? Is that really the...
So two parts in that question, great questions. Number one, 5 years is just to really change the life expectancy. It takes that long to see it. And it's the University of Wisconsin population study. That's a third party validator. It's like having an outside auditor to come in. So that's the 5 year thing. And to get it started, the reason I talked to the hospital board is we had money. The hospital had money to spend. And I said, we don't need another OR. We don't need another, sickness place. We need another wellness place. And that's why I talked to them. They had the money. Around here, you've got a couple of hospitals. You've got some other big communities. You know them far better than I. I'm just here first time I've driven through. So I'm a newbie here, but you know who's got what. And the question is to get to some of the foundations, to get to the folks who can spend the money. And this is a big county. Geographically, it's huge from end to end, from Claremont up to here or over to Mount Dora. I've been to Mount Dora. We bought some furniture there years ago, a couple times, more than I want to think about, actually, because I ended up carrying it, whatever. But it was a good experience. But you've got a big county, so it's not inexpensive. Now, the thing to do is just say, well, we're just going to do this area right now, and we'll get there later. And that's what we did in Southwest Florida. We started in one area, and then, but they had the hospital board had the money to do it. We got to find somebody here who's got the money to do the initial. Then we'll take off.
And I wanted to add one more thing to that. So a third part to that question is you kind of highlighted and emphasized. I know that there's the pillars for the blue zones, but the biggest things I heard you talk about were smoking and intake of food. Is that
That's because we're talking with nurses and healthcare professionals. And and so night nurses, this is really prejudiced, probably, is that they need to stay up at night. So how do you stay up at night when you got kids in the daytime, you don't get enough sleep? You eat. So the night nurses, so it's a big deal. We didn't have, the hospital employees weren't different than anybody else. We got the downtown smoking rate in Naples down to like 1.5%. We got our own employees down to 1 or 2%.
starting at the hospital, which is the hospital mindset, not even trying to sell it to the community?
No, to get to the down, we had to sell it to the community. We had to do our own employees first because nobody believed it. Okay, the board was saying, look, you're a nice guy, but if this doesn't work and we're spending this kind of money, you just used up a lot of credibility. Maybe enough so that you're going to free up your career, maybe not, because we are just, whatever. But that's always the case. You got to do what you think's right, or else you'll just relive your life with regrets. You got to go for it.
And it made a difference.
It exceeded expectations. And then when just to finish up that little part of the story. So then I was ready to leave being a CEO of a hospital. It's an 18-hour job. It's crazy. I did it for 18 years. I was 71 and a half, and I wanted to do another big monumental thing. But then the Blue Zones folks came to me and asked me to help out. So I'm here as a volunteer today, essentially. When I fly someplace, I get travel expenses, but this doesn't cost anybody, a little gas. And I got to see the grandkids last night, so I'm happy.
Do they have any grants available through the Blue Zone?
There are a bunch of grants. There are other granting agencies. The Blue Zones folks themselves don't have grants and that's a good question. Everybody asks for that. But not me, but we got a whole group of folks who know how to write the grants and know where the grants are. And we got a grants committee and they talk to each other. I don't meet with that group because it's not my thing. Well, once in a while I'll listen in, but they help with getting grants. I've never seen a community do it just with grants. I've seen them with a foundation getting it started, or a healthcare system getting it started, or later today with a college getting it started, and then getting it. And once you get success, then it grows. It's terrific. Then it just spreads. Please.
Would you comment on the role of exercise in, especially for older people to get wage flow down?
So the question is exercise for older people and the value. You cannot be underestimated. Staying moving and doing things. Now, the thing with exercise that doesn't work is when you make a New Year's resolution. That lasts like 20 or 30 days, and you join the gym and you buy a year membership, and your spouse is saying, what'd you spend that money for? You're not even going. So that doesn't work. But what does work is getting out and walking every day, getting somebody that you have to meet to walk. For our age group, maybe we're not the same age group, but I suspect we are, doing some light resistive work every day. You're not trying to be like our 13-year-old grandson who's walking around without his mom. It's a pediatrician. Put your shirt on. But we're not trying to do that. But just getting some aerobic exercise and general strength training. The other thing is balance is so important in our age group. The number one reason people end up is a fall, and that starts a whole bad cascade.
Okay. So you've got Dr. Allen's contact information, hopefully.
Mhm.
Any other final burning question before we give them a final round of applause? Don't go too far.
One quick short one. I was in Maine one day at a client and they did stretch breaks. And it was the first time I had ever seen a company do that where instead of their employees that smoked still went out and smoked whenever they smoked. But when it was a stretch break, the whole office came together and they sat and they literally took their toes and stretched out. And is that the kind of
Small level, easy, and it depends on the situation. If that's exactly one of the things. So you get a group that's in that situation, and it works out great.
It works for kids in school too, if they just have a stretch break between periods.
All right. So thank you. Let me get a couple gifts for you, Doctor. Thank you. So first of all, here's a coffee cup. It's got a little note in there. That is actually kind of a gold thing. Don't put it in a microwave. But second of all, an appreciation sincerely for you driving up here kind of on your own nickel. We'd like to gift 50 polio vaccines in your name.
Thank you.
So that 50 more kids don't get that dreaded disease in the world. So as you know, polio is still out there, but we've been working. Rotarians have collected $2.1 billion with a B and vaccinated 3 billion children. We believe in vaccinations against a dreaded disease.
So I neglected to say how appreciative I am of Rotary for that and potable water and all the things that Rotary around the world has done that no other organization could do because you're around the world doing these things. I think polio is just left in Afghanistan and
Pakistan and Afghanistan, correct?
Wow.
So, and again, I see our action step. Hopefully, we've got some opinion leaders. I don't know all of you. I'm the damn Yankee from up north, but those of you who do want this effort, he has said he's willing to come down to a broader group of perhaps the Lake 100 folks, some of the other city leaders, community leaders, maybe even some of the faith leaders. I know one, Pastor Mike, who's the pastor for the um, police chaplain for Leesburg, wanted to be here because he's not only an athlete, if you've seen him working out, but he really believes in this blue zone stuff. So hopefully we can get you back here, especially since it's halfway. You can go visit your grandkids in Tampa and just come up our way. So thank you.
Why is this important and why are you here attending this meeting today?
Well, I am a Rotarian and I'm excited to hear the studies of what's going on with the Blue Zone. I am a daughter of a 99-year-old, so I definitely believe in the existence of the Blue Zone and how important it is. This will be very interesting to learn how much research is being done and what is being found, and I'm excited to represent as a Rotarian and as well as being a city commissioner here to represent the city.
So, are you shooting for 100 to try and carry on the tradition?
I hope and pray I make it, but the way things looking, I don't think I will make it. But that is a good goal for me to have. And yes, I love taking care of my mother. She's my main priority. And this is why I'm here back at home in Leesburg. So yes.
blue zones are areas around the world where more people live to be 100. Then taking the principles from these 5 places around the world where more people live to be 100, taking those principles and bringing them here to areas, 75 areas around the country where people aspire to have all of their citizens across the socioeconomic spectrum live longer, happier, and healthier lives are what blue zones are. So in Southwest Florida, we did that starting in 2015. And in 2021, we were certified. And we added 0.6 years of life expectancy for about 400,000 folks across the socioeconomic spectrum. So you have to have a significant number of people who have embraced the idea of living healthier, eating better, socializing with others, having family and friends nearby, having purpose in their lives, moving naturally, works perfectly, and having a reasonable diet, not necessarily a vegetarian, but a plant slant diet where more people embrace healthier activities. Communities do get together and they're surprised about how the changes come about. Sometimes people think they can do it themselves, and that's nice, but it never happens. Until they get organized with with other people on the same journey, seeing other ships at sea going in the same direction and sharing best practices makes a big difference. But if you think you can do it on your own, that's nice, it's aspirational, but it just never happens.
So some of our ideas have to do with the historical nature of downtown. How do we make this city more walkable? Because moving naturally, getting outdoors into the community with, parks and sidewalks and bike paths are a big part of the Blue Zone methodology, so to speak. But in addition to that, it's really building community. How do we bring back some of the Blue Zone principles are really around how do we bring back kind of the faith, family, friendship, communal activities that were very popular here 100 years ago, and we hope to kind of bring back again. Some of that's already happening. We'd like to see more of that happening because it leads to not only a healthier community, but a longer living community. So there's a lot of payoffs, especially for the young people. Many young people in our community don't see a future here. They leave our community. If we can show them not only a future of long life here, but the ability to really get involved in the Blue Zone experience, we find that young people love the Blue Zone methodology.